Greetings from Team Indian Medical Association. I am Dr. K.K. Agarwal, President-elect Indian Medical Association and currently the Honorary Secretary General IMA. Welcome to our weekly show every Thursday 3 to 4 p.m. a webcast where we discuss some important issue. In association with Librate, our digital partner, and eMediNexus, our webcast partner. Today we are going to discuss about neonatal care, skin care, in neonates, sleep hygiene, and other aspects of hygiene. And I have two experts with me. I have with me Dr. Rajeev Malik, who is a senior consultant pediatrician at Mutual Med City in the city of Delhi. And I also have Dr. Ramesh Datta, who is also a pediatrician, who is also joint secretary at Indian Medical Association. Welcome to our show. This CME is being granted, some grant has come from Johnson & Johnson, but none of the contents of this CME are influenced. We are not talking about any brand, we are not, so the contents of these are absolutely of our experts and not influenced by Johnson & Johnson company, who happens to give an educational grant to conduct this CME under IMA Johnson & Johnson initiative, where we are doing a lot of educational activities with them under a grant. So, Rajeev, welcome to our show.
Thank you.
When we talk about pediatrics, so we have some terms. So we have antenatal, natal, and postnatal. Just to recapitulate, just define. Antenatal is?
Antenatal is the period when the baby is in the womb and
Zero till delivery.
Zero till delivery, and once the baby is born till the age of 28 days or 4 weeks, we call him a neonate. After that is an infant, then toddler, then adolescent.
So infant will be from 1 month to 1 year.
1 year.
Okay, and toddler will be from 1 year to?
Till he goes to school, that's about 3 to 4 years.
Usually we used to call them as 5 years earlier, but
Yes.
not
4 years now.
With that. So when a person is born, but before that, let me spend a couple of minutes in antenatal care. How do I look after my baby while the baby is still in the womb? I'm not talking about care of the mother. So what are the stimuli? Should the mother talk to the baby? Is there any role of good music? Is there any role of good listening, as we had in our shastras, that the child is listening? So anything which can be done to make my baby grow better.
Apart from nutrition, which is well known, that mother must have good nutrition, especially iron, calcium, and folic acid, and a good protein diet. This is known that baby listens to the maternal sounds which are there, especially the heartbeat, and they find it very soothing. Of course, there is no scientific way of proving the mother talking to the baby how it helps, but it is hypothesized that it calms the baby, and the baby is able to recognize and bond with the mother much better after birth. So
in our Vedic sciences, they always be saying, give a nickname to the baby.
Yes.
Talk to the baby. The parent should talk to the baby.
Yes.
And if the mother is angry, the ultrasound has shown that
Yes.
the mother is angry, the baby inside is uncomfortable.
When the mother is angry, then there are hormonal changes that occur. The catecholamines are released, which will affect the baby also. But apart from that, the atmosphere the baby gets at that moment helps him to be quiet later on, to be peaceful baby later on. And talking to the baby, what you are talking is not only beneficial to the baby, it's beneficial to the parents also. The mother also gets a good sense of bonding with the baby, and these help. It has been shown, apart from this, even especially there was a study of bonding when a baby is breastfed, which is also helps in bonding. These they tend to be much better personality-wise individuals, and in fact, most of the criminals.
Kangaroo care has come from that
Yes.
reason only.
Yes, absolutely.
So now when it comes to, there is a festival called Baby Shower. We used to call them as Bodharai.
Okay.
Okay, where the time you say the baby is viable, say 20 weeks,
Yes.
when the viability comes,
Yes.
now you know the baby is definitely going to come, unless there is a
Yeah.
catastrophe. Till that period, you're not sure. Abortions may happen or something may happen.
Yes.
And the day you know that baby is coming, you call it as baby shower or a Gurbarai, and then you have a ceremony And everybody, in fact, that's the time when you're supposed to declare that she's pregnant. Because you're not supposed to declare she's pregnant. If she aborts, no, that's the Vedic description is.
Okay.
The Vedic description is at that time abortion used to be high.
Officially,
So they never used to declare that she is pregnant
Okay.
outside the family. So
Okay.
the day you declare means now the baby is
20
coming.
weeks.
20 weeks,
Yeah.
whatever time, 20 weeks. And at the time, the baby shower and the Bodhvarai program basically is now to prepare the baby, mother for the baby. So what are the training should be given after the Bodhvarai or the baby shower function, so that she starts preparing for the delivery and the care, so that she is sensitized. She is not taken as a surprise
Yes.
how to handle the baby. So from 20 weeks onwards, training is given systematically to the mother about the baby care. What are those aspects?
So one thing I mentioned earlier is good nutrition and
That is for the mother.
For the, you're
What are the
talking.
child? What training should be given to the mother to prepare herself to be
Yes.
ready at the time of delivery, that at the time of delivery, how to take care of the child, how to take care.
Yeah.
So all those things, they start getting training.
From baby's point of view, the one single most important thing is that she has to understand that the baby has to be breastfed.
No, before that.
No, this is, yeah, no.
Before that, cholesterol.
Huh. Yeah, no, I am coming to that. Baby has to be breastfed, so she must be competent to breastfeed. We do find a lot of mothers after they deliver, they are unable to feed simply because their nipples are retracted or not coming out properly. This could be well taken care of
Before.
in the antenatal period.
Yes.
But there are certain exercises and moisturizing creams which help the nipple to come out, so that the nipple is ready
Yes.
before the baby is
So
born.
the nipple is ready. That is one.
Yes. The second thing, the mother must be told that the initial milk, which is called colostrum, is very nourishing to the baby, especially in terms of antibodies.
And the first hour feeding should start.
Yes, within 1 hour, the mother must feed the baby, and it helps in bonding, it helps in giving protection to the baby by giving antibodies.
And then nowadays there is a concept of keeping the cord for some time and till the cord comes to the mother. Or to the
Yes,
baby.
that is another important thing. I think if there are any obstetricians listening to us, it's very important
No,
for
I'm
them.
saying these are the things which the mother should be sensitized. Otherwise, she will say, "Why are you doing that?"
Yes,
So all those things, if you believe in that, if you're delaying the cord cutting, the mother should be sensitized.
absolutely,
The
certainly.
mother should be sensitized about all aspects of
Yes.
labor, and then the importance of normal delivery versus cesarean delivery,
Exactly. So,
and the importance of husband being there at the time of delivery.
yes, it
And many
helps
times,
in
see, at the last moment, if you do that, if you prepare, you get 3-4 months.
beforehand. Yes,
So therefore, what I am trying to emphasize is that it is not only important for the obstetrician to take care of antenatal care. IMA feels that the last few months, the so-called who was the pediatrician who is going to be should spend time. The antenatal mother should also go to the pediatrician,
Yes.
spend say weekly, once in a month. Spend time with her.
Counseling by
Counseling by the pediatrician. The pediatrician should also be able to prepare
Yeah,
for the baby.
exactly.
That concept is
Counseling should be
missing.
there. Yes.
Yes.
That concept is missing because
No,
people at the
yes.
time of delivery come back, who is going to be my pediatrician?
Yes.
That shouldn't happen.
yes.
So they should hire their pediatrician at 20 weeks or whatever we
Time,
decide.
yes.
That concept IMA wants to promote.
Yes, I
So that's
absolutely,
missing.
absolutely agree with you. So far, we are finding few problems. One is the nipple problem I told you. Second is preference for a cesarean by many mothers for different reasons. Cesarean babies are at higher risk of respiratory problems, especially
Then,
transient tachypnea of newborn. And of course, there is danger of life to baby and mother. It's a surgical procedure.
So
And
therefore, instead of gynecologist, the pediatrician should convince her
convince, yes,
that don't ask for cesarean just for your comfort.
exactly. And you have very nicely brought out cord clamping. In India, we find lot of anemia of infancy, mainly because the cord is very hurriedly clamped. If you look at the natural process of birth, the blood will keep on pumping after the birth occurs, and if there was no assistance, it keeps on pumping until it actually
And
stops.
also in the importance of giving the child, take it out, give it on the lap.
Yes, put it on the abdomen
Abdomen.
of the mother. The mother can feel the baby, and
Now, all these things will not happen if the mother is not prepared.
Yes, she
May
should,
not happen.
she should know what is going to happen.
So she should
and,
supposed to
exactly.
know, she's supposed, because she can remind. Sometimes what happens is, the child is, sometimes there is an emergency, the doctor may get diverted, the nurse may get diverted, but if the mother knows, she says, "Bacha do."
Yes.
It is equally her responsibility. It has to be a shared responsibility
So,
between the obstetrician, pediatrician, father and the mother.
Exactly.
This is what I'm trying to say.
Awareness of the fact.
So father plus mother plus pediatrician plus gynecologist,
Gynecologist.
Shared
responsibility.
responsibility.
absolutely.
Yes.
So most of the times the pediatrician is not involved.
Never, it is never, they are never involved.
Yeah.
Unless it's a high risk pregnancy, in those cases, like premature birth or something, that is the time we are consulted by the gynecologist. But this consultation of the mother, to be mother, with the pediatrician is a very good novel idea, and I think it will help the delivery as well as the mother, preparing the mother, and as well as the health of baby.
Absolutely. Because the time baby is born, gynecologist is out.
Out,
No,
yes.
no,
for
these days, gynecology, if some problem is there, they consult the pediatrician themselves, Parents are not aware
Parents
of,
are-
not aware of who is the pediatrician and how he is going to tackle the situation. So that is not there, but it should be in our curriculum that the pediatrician should be involved in the antenatal care itself.
So another thing which comes is genetic counseling and congenital counseling. We talk about counseling pre-antenatal, antenatal counseling. Today the decision is taken by the mother, by the gynecologist. Shouldn't say for example if the child has a complex congenital heart disease.
You mean antenatally
I'm
diagnosed?
only talking about if we haven't the infant hasn't been born. At the moment we are still in the antenatal phase. Then we come back to the neonatal care. So what I'm trying to say is, suppose, say for example, the child has a congenital heart disease and it is between 12 to 20 weeks.
Yes.
Okay, gynecologists won't know whether this is compatible with life or not. The mother and father say we don't want any congenital heart disease. Maybe that congenital heart disease is completely curable. Only a pediatrician can tell, but the pediatrician is never involved.
In the urban setting, we are now having regular antenatal ultrasound examinations.
No, I'm saying diagnosed.
You are talking,
Ultrasound has diagnosed a complex congenital heart disease. Now who takes the decision? The gynecologist or gynecologist and pediatrician together? This is what I'm trying to say.
No, that's why, in these days, pediatricians are not involved. It is a novel idea that pediatrician should be involved so that he can discuss with the gynecologist and convince the gynecologist that this is the disease which is curable after birth.
nowadays the fetal medicine specialist who is doing the ultrasound, they are the ones who are advising. Actually, they are competent.
To tell whether it is compatible with life or not, they are compatible, they are competent in diagnosing.
No,
But
but
not
the
to tell whether
pediatrician
it's
should be
compatible.
involved.
Yes.
Gradually, pediatrician
They are not
should be
going to
involved.
make
Once it comes,
None of
once,
that.
yeah, if it comes to that,
So in other way, I'm trying to say, what are the diseases which are incompatible with life? Where at the age of 18 weeks, you can say, go and abort. I don't want to see the child. What are the diseases which pediatrician would not like to see?
incompatible with life is very difficult to diagnose antenatally, but difficult to treat, yes. So, say
Why I'm asking
a
this-
single
why I'm
ventricle,
asking this
single
question?
ventricle.
There was a lecture, and somebody came back and said that do this. All patients with mental retardation and all patients with Mongolism should be diagnosed early so that they can be aborted. Okay, so I have a question as an activist of IMA. I have a question. That is mental retardation an indication for abortion? If so, then all of us when we become demented, all of us when
It is a million-dollar
we
question.
develop Alzheimer's or Alzheimer's, we should be killed. The children should have a right to kill us.
This is a very sensitive topic.
No, I'm only asking you on
Yes.
principle. I'm asking you on
Yes, see,
principle.
let us say we have diagnosed Down syndrome. Now, in Down syndrome, there is a huge variation.
Yeah.
A mental retardation could be very mild, could be very severe. They could be having a congenital heart, maybe a VSD,
Curable.
or,
Yeah, curable.
and the other thing they suffer mostly is hypotonia.
Hypotonia.
So mental retardation is the main thing which you can't diagnose antenatally. What will be the degree of mental retardation? Now,
See what I'm saying? Severe mental retardation, is it an indication for abortion? If yes, I will need a justification for that. Because the reason being, all of us are dog lovers, all of us are cat lovers. We spend millions of rupee to look after our dog and cat.
yes.
Okay, they are also mentally retarded as far as I'm concerned. But they don't have your intellect.
So
So they only smile at you. A mentally retarded person at least will have that much IQ that he will smile at you.
No, but this is my experience that parents are more attached to such children. You know. They are much more than the normal children. You know, that I have seen. This is my personal
Because I
experience.
objected to that. Because that came for an award, and I was in the jury. I said I don't want to even look at it. You are coming out with technologies to diagnose mental retardation early and abort. And then it will be now what will happen today, tomorrow what will happen is that all cases they will say female feticide. No, all female feticide will come back down. You only have to write down. See, a doctor will have to make a report. In a female feticide, he will make a report he is suffering from Down syndrome. What? So he doesn't have to write down male or
The
female.
question that you have put is whether a severely mentally retarded baby should be allowed to take birth or not.
Yes.
Now, the answer to that is not really medical. It is more of an ethical issue. The society has to decide whether we want mentally retarded children to be aborted or not. Because nowadays,
Is
if
there a
you
law? Is there a law? I want to understand this. Is there a law? Is there a something?
law says incompatible to life,
Therefore, I ask you a
And-
question. Are they incompatible to life?
and also that child will be grossly abnormal, and the parents.
So all muscular dystrophy should be killed.
Yeah, exactly. It will be like that.
Then why only mentally retarded? Does all
Yes.
complex congenital heart disease should be missed? A person who cannot afford.
So,
So a
I
person
think-
suffering from a single ventricle, if he cannot afford, should be aborted.
so more than medical, it becomes an ethical problem. So nowadays you find parents are not even willing to have a child because they want to have a independent lifestyle. Or if at all they have one child, and if they don't want to have 2 or 3 children, they don't want to become full-time
Anyway, let's go.
parents.
My purpose was to raise this issue, but I
Yeah.
know that there is no answer for this. There is no answer for this. The child is born with jaundice, and people have a habit of phototherapy, and people think that sun therapy is the phototherapy. Is it true?
This is a very good question. Normally, all babies have jaundice. If we take by adult standards, then all babies, 100% babies develop jaundice, which is physiological because fetal hemoglobin is getting hemolyzed and adult hemoglobin is being formed now. During hemolysis, bilirubin is liberated. The liver is usually mature to handle this and not allow the bilirubin to go beyond 12 or 13 milligrams. So we call it 12-13 milligrams indirect bilirubin, we call it as normal physiological. Now, if it goes beyond that, then there are two things. One, is it because of some pathological problem? So that needs a diagnosis, whether it is AVO incompatibility, RS incompatibility, cephalometoma, galactosemia, hypothyroidism. Those are the medical problems which can lead to excessive jaundice. And the other thing is jaundice by itself, the level of jaundice, can it harm the baby? Supposing the jaundice is 25 milligrams bilirubin, probably it could lead to kernicterus. So one is to bring the level of jaundice down, other is to find out whether it is physiological. If it is physiological, no treatment is really required. If it is not physiological, but it is going high, say 17, 18, 20, then it requires treatment. So when treatment is required, there are only two options. If it is very rapidly rising, it is exchange transfusion, or sometimes we give immunoglobulins. If it is some incompatibility. If it is not very rapidly rising, which is 99% of the times the case, then we give phototherapy. Phototherapy is a light around 440 microns wavelength, which is a whitish bluish light, under which when you expose the baby for nude baby without clothes, nude baby for about 24 to 72 hours, then we find that the jaundice comes to a safe level. Now, firstly, sunlight, which will have all the radiations, including this wavelength light, firstly, that light must be put on the baby in a nude baby for that length of period, and that concentration is going to be much dilute because it has got everything. So it is not really going to affect the jaundice at all in 10-15 minutes or half or 1 hour of sunlight exposure. So it is not going to help. Practically, can you make the baby nude in any of the weathers, whether it is summer or winter? You cannot make him nude and put him in the sun. If you
It
do
is not going to harm.
what?
Sunlight for vitamin D
Sunlight-
purposes.
Sunlight up to the age of 6 months, the baby's skin is not mature to handle some of the bad radiation from the sunlight.
Now, how do
Especially
we manage vitamin D deficiency in newborn?
well,
Do we need
newborn.
sunburn? Do they need sunlight or not?
No,
sunlight.
not to the extent that should.
No sunlight for 6 months.
No sunlight means filtered light, yes. Not direct sunlight, no. Because it can 10 minutes exposure of sunlight to the baby will cause sunburns. So that is the problem. So your question about vitamin D, most mothers are deficient of vitamin D, and their milk is not having vitamin D because of that reason. This is one of the points. If you come back to the antenatal care, vitamin D is another point which must be checked in all mothers and corrected, because we get lots of babies who are born and become hypocalcemic because of poor vitamin D in the mother. And recently we had a baby who had convulsions.
Okay, we come back to nowadays. We come back to sleep.
Nowadays we are-
It is regular practice now.
Nowadays we are giving 400 units of vitamin D to all babies.
Units of
All
vitamin D
babies.
for 1 year.
Yes,
Every baby.
400 units.
1 year.
Yes.
400
Let's talk
international units
about
up to 1 year of
some
age.
of the. Let's talk about circadian rhythm.
Yes.
At what time the circadian rhythm develops in the child?
See, when the baby is in the mother's womb, so it is night all the time. So when he comes out, he is not developed, any circadian rhythm will develop only once the baby is exposed to periods of day and night.
That will be
So it takes about 6 weeks
after birth.
after birth when they start realizing that there is a day and night, and this rhythm
So
starts.
there is no
developing.
circadian rhythm in the baby when the baby is in the
No,
womb.
no,
Yeah.
no, there is
It's all
no.
night.
It is all night.
No much night. 9 months.
And then another thing, what
Inside, you know. Inside.
And then another thing, what happens after birth is when the baby is sleeping, so everybody is quiet, shh, to baby so raha, parda band, ye band, light band, everything. So it becomes night for him. So this delays the development of circadian rhythm. Even at 6 weeks, it may not develop well. So with the result, baby will sleep for 2, 3, 4 hours and then be awake and then again get up. So there is no rhythm at all.
And this is only sleep rhythm or all rhythms? Like heart rate rhythm, other rhythms?
No, this is sleep rhythm, but with that will be associated also other rhythms, yes.
Like cortisol rhythm, like heart rate, like various phases.
Yes,
They all will.
they will synchronize with the
They
circadian.
synchronize, but there is no direct effect. It is synchronization, but there is no direct
no.
adverse effect on
No.
that. Yes. There is no direct adverse effect. It is a synchronization. Usual synchronization, regular with the child.
Anything related to time, place, date of birth, people talk about it. People have started planning that my birth should take place in a particular day. And what are the norms?
What are mythology only? Myth?
These are-
What I'm trying to say is, again, my question comes back to again same thing, Ramesh. My question is that, again, pediatrician is not involved.
Yeah.
The decision is taken by the gynecologist.
Gynecologist.
The person says, I want a delivery on 18th.
Mother
The
and
pediatrician is not in picture. If the pediatrician is also in picture, what will the pediatrician say? Is what I'm asking.
If If it
Will
is a,
pediatrician agree to the mother and father to deliver it on a particular day or a particular time?
if it is going to be a normal delivery, which we would like to profess that please have a normal delivery, there are many advantages of normal
No, can
delivery.
you induce in delivery?
So-
suppose somebody want delivery on 17th, will he they induce
So
on
if,
16th?
if the child is mature enough, we can agree to that. But we cannot, agree if the child is not mature enough to go.
More than 38 weeks.
Yeah, more than 38 weeks, the child is, child can
But,
go.
but even then,
Normal pediatrician.
I personally will not.
Yes, that's what I'm
I
saying.
will
No,
not.
it will lead to confrontation then.
No,
That
the
is-
question is not that.
Yeah.
We are not discussing the relationship between the pediatrician and the gynecologist. We are discussing about the safety
It can
of
lead
the
well,
baby.
that.
We are talking
I'll
about
give you a specific case in this. There is
will a premature induction of labor,
No.
even if it is 0.1% risk,
No, we.
Is
yes, there is. I was coming to that.
But we will not at least.
No, we will not advise. There is a real case. A very close colleague of mine, his daughter was to deliver, and she was 37 plus weeks, and she also had gallstones. So she was getting very acute pain every now and then. So one pediatrician was consulted, and he said 37 weeks तो हो गए हैं. I think you go for a cesarean. उसी के अंदर गॉलस्टोन भी निकाल दो और cesarean करके बेबी भी निकाल दो. And this, he consulted me then. So I had to give him statistical figures of 37 weeks as compared to 40 weeks. What are the chances of getting HMD? What are the chances of getting infections? Although they were very small, but I gave him the data and he said no, we will wait. So there is a risk of delivering early, and if it is an artificial delivery, it is riskier than a natural delivery, even if it is induced in labor.
So no induced delivery.
Unless he gets into postdatism or any other
Yeah.
reason is there.
That is the medical reason.
Post
That's
dated or something.
That's right.
Not for convenience.
No.
Not for convenience.
No.
No.
And similarly, CS. People come back and say there is cesarean because.
Most of them request CS when they ask for this date and time. तो वो CS ही के लिए होता है और वहाँ पे
गुरु जी और महात्मा जी से पूछ के आए होते हैं.
हाँ,
So from a pediatrician point of view, no.
absolutely no.
So from a pediatrician point of view, no. Okay. Then quickly tell us about the sleep patterns in children.
See, we discussed from before the baby's birth, 20 to 22 hours the baby is sleeping. After birth, they sleep.
Is there any specific time when he is awake? When you say 20 hours or which are those 4 hours?
4 hours when the child requires feed.
They
The
talking
child is
about
hungry, huh?
antenatally, they say that when the mother is moving around, it acts as a
Kicking.
lullaby to the baby,
Kicking.
and he goes to sleep. And when the mother is quiet, then this baby gets up and kicks around.
Kicks around. Yeah.
That is why.
That's right.
And probably the
So if you
same.
want to talk to your baby, then talk to the baby when you feel the kick.
Yes.
Yes.
When the baby is awake.
That time the baby is awake.
Yes.
All is well.
Yes, all is well. And after birth is 16 to 18 hours of sleep for first 3 months, gradually becoming less and less.
Yes.
And from that, then onwards, till he is a toddler, the sleep becomes approximately average, if you say 14 hours,
14 से 16.
14 to 16 hours.
16 hours.
And by the time they are about running around 5 years, then it is 10 to 12 hours. And that much sleep is a must for a baby. Sleeping is a must because when the baby is asleep, it is during that time the brain development is occurring. All the synaptic connections are being formed when the baby is sleeping. So if the baby sleeps less, then you will find the level of intelligence will be low. There will be less of alertness during daytime. A well slept baby is much better behaved baby, and you will find his eyes are very starry and he is absorbing all the information from the environment compared to not sleep well. In fact, the incidence of ADHD, that is attention deficit hyperactive disorder, is much higher in babies who don't sleep
Sleep much.
well.
Less, huh?
And as a part of treatment of ADHD also, if you can make them sleep well, they quite enjoy.
So at the time of baby, quickly, eye, vision, and then deafness, just quickly.
Examinations.
Juvaru test. I'm not talking about Juvaru test. Another should be able to say. So one is yes.
So nowadays we
चम्मच की तरह।
that shows gross hearing defects, which absolutely नहीं सुनाई देता उसको. That of course you can do that, but we must do auto acoustic emission (OAE). It's a very simple test. It's a small size of a telephone, and you put a probe in the ear. Yes, we are doing for 100% babies.
Okay.
Yes.
So
It will test for most of the frequencies that he can hear well. Otherwise, you can have a specific frequency loss, and these babies develop again learning problems.
we have a guideline at national level that every baby should be checked.
No, these are available at higher centers only. Not all centers are not equipped with.
But I will request that through IMA, you can know the test is costing. They are charging 800 rupees at Mulchand. The patient is paying 800 rupees. Who is getting how much? I don't know. Machine cost. It's about 1 lakh.
So
Approximately.
1 lakh, say, what will happen with 1 lakh is that most of the pediatricians may not buy it unless they have to practice, unless they are dealing
No,
with
it
lots
is
of
done
babies.
immediately after birth in the hospital.
No, you mean the hospital should have or nursing home should have that equipment
Yes,
rather
where-
than having pediatrician. It should
Jab-
be the routine procedure in the nursing home or a hospital.
Wherever the birth is.
Set up,
Vision.
antenatal setup.
Vision.
For vision, we don't test the acuity, we don't look at the retina, we try to rule out congenital cataracts. So congenital cataracts, if not treated early, can lead to complications.
So that's easy to see. But then
So
we
you
don't
see
check
a
the
red-
result.
red
When to check the,
results.
when is the time when you check the result?
Only when he starts reading.
Starts with it. Anything else? So we check for vision, for this. Any other thing we check?
We do, for all babies, we are checking TSH.
That is blood
No,
test.
try
Very
it.
good, very good.
Okay.
Many that otherwise,
Clinical.
physical or clinical. Clinically, hearing
One is
and
deafness, one is hearing. Any other
eye.
taste? Do we check the taste?
Taste, no.
No, we don't check the
No,
taste.
no.
Tactile,
Tactile means, naturally the baby, when you examine the baby, you do all the examination.
Reflexes and-
Reflexes, unital
Reflexes are-
I need to
Reflexes are
understand,
examined.
I need to spend some time on ADHD. It's a very
ADHD,
versus.
I don't know, in my personal experience, I think you can watch me out, that we are, at least I am finding, that the incidence of ADHD is much more than it was 30 or 40 years
Yeah,
earlier.
yeah. It is gradually it is increasing.
Increasing.
What does
You can say.
exactly ADHD means? In a common man's,
This is a normal child
normal child.
with a normal intelligence. Sometimes they are super intelligent, but they lack attention span. They
Mhm.
cannot focus on one part and concentrate on one job. So they will flirt from one thing to another, and they are hyperactive. So there are two components: poor attention and hyperactive. Hyperactivity is a motor behavior. If you have a child in your clinic, वो कभी he'll climb the sofa, sometimes he'll open the fridge,
चीज़ उठा
sometimes
लेगा,
he'll throw
कोई चीज़ फेंक
something.
देगा।
So
वो सब चीजें वो लोग कहते हैं।
And then this
Anything.
is self-limiting. This is
when we see them at a younger age,
out of 100 children who will have.
how many will have? Offhand,
3, 4, 5.
No, it is almost 10%.
maybe I am not.
Yeah, around 10% children they are having this behavior.
The reason,
Now, there are many hypotheses. One of them is sleep deprivation, as we mentioned,
Yes.
and the other one is that they have not been employed into a positive activity, making them their mind waver around everywhere.
So this requires basically counseling or?
Yes.
Yeah, they are.
And parents, they don't have time, both are working, they don't have time, they are with grandparents are not bothered, that counseling is not proper.
Probably-
That is one of the reasons,
Yeah, probably this is one of the reasons. It is like if you have a dog at home and there are a lot of people to love the dog. Everybody, you don't tie him up. He's liberty to move. You take him for a walk, run, and everybody loves him. These dogs are very nice, well behaved. Another dog, you lock him up in a room and chain him, and somebody beats him, somebody doesn't talk to him. They become ferocious. They actually become hyperactive.
That is the reason,
So I think this is one of the reasons that we are locked up inside concrete jungles. Parents are gone for work. There are no other children because एक आध बच्चा होता है अभी, so nobody to play.
Grandparents also,
So,
they don't care
this is
much
leading
for
to-
that.
So ADHD is a problem, and also people should be watchful about that, and it is manageable.
It is manageable, but it requires special management. As a pediatrician, we don't really treat ADHD. We send them to developmental clinics, which are developmental pediatricians who have a teamwork of psychologists and counselors. So they try and figure out what the real problem is in the environment. So they try to correct the environment. Sometimes medication is also required to soothe them down.
So it's a problem.
It is a problem.
Yes, it is there. Counseling requires sometimes 6 hours, 8 hours, 10 hours, to figure out the problem, where the problem lies. So that's why there are special counselors for, managing such children.
So anything else the general practitioner must know about the sleep disorders? Do we get sleep apnea in children?
Yeah, one thing they must know before sleep apnea is that how to handle a baby so that he does not develop a sleep disorder.
Sleep hygiene.
Sleep hygiene, you can call it.
Mhm.
So, starting from the newborn period itself, the baby has taken a feed and you find that he is sleepy, you should put him to bed. A bigger baby, don't try to rock the baby or pat the baby and forcibly make him sleep, because that makes it a habit and he depends upon an external factor to put him to sleep. He must learn to sleep on his own, which means that when he is slightly sleepy or drowsy, he should be put to bed and allowed to go to sleep on his own. If you do it from the very beginning, then he learns how to go to sleep.
Similarly, do not wake if sleepy.
Yeah, supposing he gets up at night, supposing आपने पैट करके उसको सुला दिया, and after 3 hours he wakes up for some reason, then he won't be able to sleep on his own. Again, the mother has to get up, and so it becomes a disturbed sleep. So this is to prevent a sleep disorder. This must be followed. The other thing you said about sleep apnea. Now, sleep apnea is a pathological disorder, usually due to enlarged glands, mostly the adenoids. Sometimes there is obstruction in the nose. Nasal terminates are also swollen. So this causes an obstructed airway, and when the muscles are relaxed when the baby is sleeping, so at that time these heavy tissues of glands, they fall and obstruct the airway. They sag and obstruct the airway, and initially they snore, that makes a noise. After some time they just cannot breathe and they go into a period of apnea, which is not good. It does affect the so many
Brain,
development
So we
of
come back to
Development of
us
brain.
quickly about few minutes on skincare.
Okay.
If you are watching this program, you can send us an email at hsgima@gmail.com. You can also send an SMS at 98110900206, and you can also later on, after the program is over, you can send us your questions, and Dr. Rajeev, Malik and Dr. Ramesh Datta will be happy to answer. We'll continue with our program on more about the skincare. Skincare starts with the baby is born,
Yes.
and you put him on the lap of the mother.
See, when the baby was inside the uterus, he had a absolute lot of liquid around him, watery liquid around him. So it was a beautiful environment all through. When he comes out, the skin has two properties, baby skin. One is it gains water very fast from outside. If you apply some water, the skin cells will absorb water very fast compared to an adult skin which may not be able to absorb so fast. And also it loses water very fast. So when there is a dry weather, when humidity is low like in winter, or the baby is exposed to heat or sun, so they lose moisture very fast, and then it causes cracking and chafing of the skin, and this leads later on to some fungal infections, usually bacterial also. This especially in the nappy area, where this diaper rashes occur frequently. So most common problem that is faced by parents about skin in the early infancy is diaper rash. Of course, we must also mention cord care and the cradle cap in the scalp.
What is that?
Cradle cap is
Seborrheic dermatitis type of thing.
Yeah.
That scab formation on the skin.
the skin.
Scaly scabs are there on the scalp.
So I think let me go one by one, starting from the ones which are normal. There are some normal skin problems in babies like melia and some acne, the pimple-like things which people sometimes think are infections, and I have seen many practitioners treating those, trying to give antibiotic creams, and sometimes I have seen even antibiotics being prescribed. So these are pimple-like things, mostly on the nose and face, and they can be all over the body. When they are exposed to heat or scrubbing, like massage, they become very red and they look very ghastly, and they often come to the doctor to show. These are some hormonal changes which have occurred because maternal hormones have crossed over to the mother, the sex hormones, and produce a pimple-like effect like you have in the adults. These are called acne, neonatal acne. So nothing needs to be done for them. They should be left alone. They cause no problem at all. The other is melia, which is sebaceous ducts, sebaceous glands, which gets blocked, and they give like white spots, mostly seen over the nose.
Especially on the nose.
Over the nose. These also do not need any treatment and should be left alone. Third is the cord. Once the baby is born, cord has to get infected. Once it's a dead tissue, it will get pathogens, it will get infected. That's how it breaks and falls off. So to say that we will not allow infection to occur in the cord is a wrong thing, because otherwise it won't fall. Sometimes we have sick babies in nurseries where we are giving antibiotics for some reason. The cord doesn't fall off for months together. So infection has to occur, but too much infection should not occur. So for that, if the baby is being bathed or the cord becomes wet, at that time it should be cleaned with alcohol. I prefer using alcohol. It not only sterilizes the colonized bacteria there, it also absorbs the water and dries it up. You don't need to apply betadine or any other antiseptics there. Don't try to put antiseptics 3-4 times a day, because no infection is also not good. Cord will normally fall off in 1 week to 2 weeks time. One has to be aware that there can be umbilical sepsis. If umbilical sepsis occurs, there may be early cord falling or delayed cord falling beyond 7 and 15 days of time, and you can see a margin of erythema around the cord. If that happens, the baby will become slightly sick, maybe feeding problems. That will require most probably intravenous antibiotics. Then coming to the nappy area, which frequently becomes red, and sometimes it gets infected, sometimes the skin starts peeling off from there. This is due to formally the nappies are considered to be at fault.
Yes.
But it is not the nappy really. There cannot be anything better than a disposable nappy. It's a wrong argument to say that those kapda nappies are better than anything. Disposable is much better always. But what happens is that they are so cozy that parents forget that they have become dirty and they don't change it. So urine and feces lying there, they putrefy and they release ammonia gas, which is what destroys the epithelial of the skin,
area.
and then it leads to irritation because of rubbing of the nappy against it also, and that irritation causes inflammation, and then fungus and bacteria cause infection. So firstly the prevention of it. Prevention is use the nappy if you want, but change it frequently.
Frequent changing of nappy.
And if this thing occurs otherwise, then give some drying time after you clean. Don't scrub the whole area. Cotton is not a very good thing to clean the soiled area, because cotton is mostly what we are using is non-absorbent cotton, and it simply doesn't do anything. You can use a tissue paper which is much better. Be gentle, don't rub too much, and let it dry if the weather permits. If it's not winter, let it dry and then change the nappy. You can use some zinc based creams, there are plenty in the market, which forms a film and protects the ammonia getting in and protects the... So nappy cream can be used 2-3 times in a day. That is about... then use of massage and use of oils, hair oils especially. Massage, traditionally, not only Indians, I have seen a lot of foreigners who come and ask me how a massage is to be done for the baby. Traditionally, all over the world, they think massage is very good. Massage, what it does basically is, when you handle the baby also, when you touch the skin is a sensory organ. It sends the input of touch to the brain, which helps in bonding. It also, any sense going to the sensory stimulus going to the brain improves the brain activity and the synapses. So any touch, tactile touch, just feeling the baby with the pulp of your finger is helpful. But when it comes to massaging in India, what we think is we are massaging a wrestler. So you take the oil and you rub. Now this sort of massage is good for a patient who is debilitated, who cannot move, is paralyzed. So we want the muscles to be massaged so that blood circulation improves. In a baby, this massage is not so very important. So a gentle massage is good enough, for which you need an oil that should be lubricant so that with friction the skin is not destroyed. So first important thing about the oil should be, it should be a good lubricant. Second, it should not be toxic. As far as possible, it should be natural as possible. Thirdly, it should not be absorbed if it is a non-vegetable oil. Like many of the oils are made from petroleum, they should not be absorbed. Oils like olive oil, and they get absorbed, no problem.
And it should be done by mother, not by ayahs.
Exactly.
You know, that is very important.
That's a very good point,
As
Doctor.
far as bonding is concerned, the massage should be done by mother only.
You are excusing the father. Mother or the
Yeah.
father?
Parents, not by ayahs,
Just to recapitulate, that massage is a science. Massage is supposed to increase VIP hormone, the selective intestinal polypeptidase, which is 200 times more coronary vasodilator. That's the reason in adults I'm talking about, I'm not talking about. Therefore, massage now is coming as a treatment for coronary artery disease.
Very
If you
nice.
have CAD and if you do a massage, then it increases coronary circulation. Now, massage can be 3 types. It can be forward, it can be backward, or it can be both. When you're doing it backward, it increases the venous return. And if your venous return happens to increase the diastolic blood flow, it improves coronary circulation. It helps us in building coronary blockages. And similarly, when you're going down, then patients where you want to reduce venous circulation, then you have a downward stroke. So upward stroke massage, downward stroke massage, both massage. This is one. And second thing is the Swedish massage. Swedish massage is the one which you're talking about, heart massage.
Yes.
Where you literally, heart massage is called Swedish massage by terminology. And then there are soft massage, tactile massage, soft massage, exotic massage, because if you're using for sensually pleasure, then they are called exotic massage, otherwise they are called basically sensory massage, which is like Thelana. more like
More like just soft.
More like this. Then there can be dry massage and wet massage. Dry massage is you only use
Powder.
rough with the powder. Amla powder is there. They are used for obesity. So in obesity, you take amla powder, use the amla powder, and you take a rough towel and massage it.
Okay.
Friction. Okay. Basically, these are dry friction massages which increase metabolic rate and they help you in reducing fat burning massages. They are called that. Or it can be an oil massage. So in oil massage, you can do it with honey, you can do it with oil, you can do it with ghee, you can do it with dahi, you can do it with milk, or you can use the standard
Massage oils.
massage oils that are available, which can be natural, which can be Ayurvedic, which can be modern medicine based. So that's how we, in adults, that's how we basically talk about massage. So in children also, I'm not talking about the neonate, this should be true even in children who are adolescents and other people.
That can be.
Oh, yes.
It is different. We are talking of neonates and infants only, not grown up people. Tactile massage, that.
Normally they do this massage maybe up to 1 year. After that the child runs away. They don't allow massage.
Infants.
Mostly infants. So what I have been advising is that no massage. Tactile massage, yes, but till 3 weeks no massage because baby is too small and the skin is sometimes peeling. So they can apply oil and do a gentle tactile massage. Only after 3 weeks they do the massage.
So now we quickly come back to the same thing. Now, is there any difference when the child is 3 months, 1 year, 2 years, 5 years, and all these things? In relation to
Massage.
skin care, in relation to sleep care, anything. Otherwise,
when a child is bigger, say he's 3 years up, so you have to, at that time you have to make a sleep time. The correct time for these children to sleep is between 8 and 9 p.m. And they must get a continuous sleep of about 10 hours, which will make them more intelligent. It will help their development of brain better and temperamentally also better.
so is there today in adults we talk about that the sleeping decibel should be 35, which never happens in terms of noise pollution. The residential it should be 45, at sleep it should be 35, it never happens. Now they say you should not use more than a zero bulb in the room, only zero bulb should be allowed. And then they talk about is that all your gadgets, electronic gadgets like laptop should not be on the charge in the same room. Your TV should be off and not on. On means just from a remote you try to control it. And your phone should not be charged in your room. It should be kept in the charge in the dining room or some other room. Are they also applicable to?
Yeah, for a child, what we recommend is that firstly, his sleep activity should be synchronized with something so that he understands and he gets into a habit. Something like a massage followed by a bath, followed by maybe a snack and some story timing. During that time, the lights must be dimmed. There should be no TV or anything which stimulates. Actually, these flickering lights, they stimulate and they make you awake. They should, in fact, bedroom should not have TV and video and these things at all.
Even if they have, you close the take
Close
the
at
Well in
a
advance.
particular time to close.
Well in advance, they should
Well in
be
advance.
taken out. Some of the children who suffer from nightmares, they should not be allowed to watch TV for at least 3 hours before they go to sleep. Because they will see some Chota Bheem or some, I don't know what all, and they then dream.
Doraemon and Chota Bheem.
See, sleep, as you all know, is of two types: REM, rapid eye movement sleep, and non-rapid eye movement sleep. REM is also called active sleep, and the other one lazy sleep. So during REM sleep, the child is dreaming, and the brain is actually acting and it is developing. So they actually start dreaming about these things, some violent things, and then they get into night horrors.
They get up in the night and start shouting and that all that dialogues, they start speaking.
So suppose, say, I'll give you the adult equivalent.
Okay.
Then just give me the pediatric equivalent. In adults, there are three things which we talk about it. We talk about bhoot,
Booth.
we talk about pret,
Yeah.
and we talk about pishach.
Yeah.
Okay.
Okay, these are the three things which we use. Now, bhoot means you are remembering somebody who has died
Okay.
and who is disturbing you in your sleep, and you know him.
Okay.
Okay, but he's not disturbing you. That is bhoot. Bhoot is you're getting memory of somebody who's on you in your time, and you get up in REM sleep. Then you have pret. Pret is somebody you know, and he's coming to your dreams, and he's disturbing you. You're getting frightened. With bhoot, you doesn't get frightened. You just get up. So pret is somebody in REM sleep, remembrance of somebody, and pishach is somebody is coming you don't know. You don't know who is he. So, and he comes and disturbs you. And that terminology is called pishach. And they all are related to REM. Okay. The Vedic answer is, the Vedic counseling and Guru Puran and Vedic answer to this is that if somebody dies with some unfulfillment of desires, say for example, I tell you something, Rajeev मेरा ये काम कर दो, and 2 दिन तक आप भूल जाओ, you don't do, and suddenly I die. So all the time you will have the guilty
Guilt
feeling
feeling.
that मैंने काम किया था.
काम तो आधा किया
So
नहीं।
you will get up in your REM sleep with
Yes.
the remembrance of that.
Yes.
So if you come back with the remembrance, that's bhoot and pret. And then pishach is somebody, you said somebody told me something.
Yes.
समझ में नहीं आ रहा किसने कहा था, and he comes and
याद
disturbs you.
नहीं
That's pishach.
याद नहीं।
And here comes his Hanuman Chalisa.
Okay.
Bhoot pret निकट नहीं आवे.
Okay.
जो this is,
Uh,
and that is Hanuman Chalisa is nothing but chanting of Hanuman Chalisa. If you chant Hanuman Chalisa with 4 lines in one go, it reduces your respiratory rate. Hanuman Chalisa is to be read with 4 chapai, 4 lines in one breath.
Okay.
So that reduces your respiratory rate to 12, 13, from 16 to around 10 to 12 per minute. And reduction in respiratory rate reduces REM sleep. So therefore that bhoot pret nikat nahi aave. Mahavir ke naam to naam.
But as you grow adult, REM sleep becomes less and less. In children,
So I'm only trying to say is that parasympathetic breathing, slower and deeper breathing in adults is the answer for nightmares. Except for SSRI,
Okay.
except for serotonin reuptake inhibitors. If you want to give, then we normally teach these people do pranayam, which is a parasympathetic breathing, slower and deeper breathing, which can be, say for example, if you want to use Gayatri Mantra or anything. Why only talk about Hinduism? Whichever thing, say Om Bhurvava Swaha Tasya Viturvarenyam Bhargo Devasya Dhimahi Dhiyo Yonam Prachodayat. Now I take a breath. Versus Om Bhurvava Swaha Tasya Viturvarenyam. If I am doing it with 4 breaths versus 1 breath, when I am doing it with 1 breath, I am reducing REM sleep.
You are stimulating parasympathetic.
Parasympathetic, and parasympathetic mode is, sympathetic mode is REM, non-REM is parasympathetic. So if I reduce parasympathetic mode, so I take care of the sleep patterns. In adults, we teach them parasympathetic breathing. At what age children can learn parasympathetic breathing?
Well, that's a new question to me. I do not really know. Maybe we have never tried of this. I have no knowledge. Maybe 3 or 4 years old should be able to. See,
No.
3 to 4 years, I don't think they will learn.
We-
Maybe around 8 to 10 years of age we can teach them.
No, between 4 to 5 years of age, I give them rota healers
Okay.
for asthmatics. I give them rota healers, they manage. So it's something like
They should
that.
be able to do that.
Yeah, maybe 5 years to
And he's
be.
puffing.
Yeah.
So, no, not with all kids, but at the age of 8
Okay,
to
we
10
are
years,
running short of time. We have only a couple of minutes left. Quickly about cough and cold children. And then, quickly, and then ORS. These are the 2 things I want to cover.
I think ORS first. ORS simply because people are still, after many years, still not understanding ORS. ORS was declared as the greatest invention of 21st century.
Yes.
Yes. Now what is happening is we are getting ORS is used to replenish the lost fluids during diarrhea. So this comes as powder and it comes as ready-made solution. Some people think that ORS is a treatment like a medicine. So they sometimes give ORS powder to the baby to drink.
With 2 teaspoons.
Sometimes they. So ORS should be made in the correct proportion, 1 packet to 1 liter or 1 packet to 200 depending upon what is written there.
It is there.
You must give as much ORS to the baby as much is the loss. What is being lost in the diarrhea, similar replacement if you do.
In adult, our formula is for every stool 200 ml. Is there any children's formula?
Yeah, we have, but it's too difficult for even me to remember.
Okay.
So more complicated for the.
Maybe the
So
age and
basically,
the weight, you know,
again, I want to go.
It keeps changing.
It is 2 to 3%. It is 2% sugar.
Yeah. roughly.
ORS is 1 liter 20 gram of
Yes.
sugar.
Yes.
With in high sugar presence.
The-
sugar is high, the sodium get absorbed.
Yeah, the glucose is absorbed by the
Basically,
intestine,
sodium goes in.
and glucose then takes water with it, and
So it
sodium
is
and
2%.
potassium.
It is-
Yes.
Suppose it is 4%, what will happen?
So it is a hypertonic solution. The absorption will become less, and in fact it may lead to osmotic diarrhea if you give more sugar.
No, I'm talking about up to 4%, 3% or 4%. I'm not talking about, see, why I'm giving this example is, see, in the market, we have 2 products available. One is a soft drink, which is 12% sugar. Limca is one
Yeah,
of them.
yeah.
Second is ORSL, like energy drinks, which have 8% sugar. Okay. Now suppose I don't have an ORS available, I want to give something tasty. Okay. Can I take ORSL diluted by 50%
Yeah, you can. You have to.
and make it as a, because then you have put some salt into it and give it.
Yes, you can do that.
Because then you are giving them a ready-made solution for those who can afford. Similarly, I take Limca and dilute it 4 times.
Yes, you can.
Convert it
Certainly.
into 2 to 3%
Yes.
and give it to the
Yeah, yeah.
Absolutely.
You can
And
do it.
in fact, we do it for children. We tell them you can dilute and give. Otherwise, the ORS, the acceptability is not good because of the potassium. Potassium spoils the taste. So the another thing what can be done is even salt they don't like. So supposing you give them a cup of glucose water, glucon D, और बच्चे को बोलो along with this you can have 2 uncle chips that gives the sodium and then half a banana later on or some orange. So it gives them everything. The main problem is absorption of water which will occur with glucose, and the electrolytes that are being lost can be replaced in this manner.
Okay, so we have 2 lines about cough and cold.
Cough and cold, again cough and cold is a viral infection. We have to distinguish viral from bacterial infections. Most children below the age of 5 years suffer from cough, cold and fever which is viral. The danger of streptococcal throat is usually above 5 years of age, not below 5 years of age. You must distinguish streptococcal infection from virus. Streptococcus gives rise to a red throat, beefy red throat, sometimes a red tongue. It gives rise to lymph
What
nodes
about
and high
in
fever.
children?
So in children, when it is mostly viral, about at least 80% or to 90% are viral, no treatment is required. Absolutely just no treatment is required. You have to take care of their fever, you have to take care of their fluids, you have to keep their nose open so that they can breathe. For fever, the safest drug is paracetamol, because all other drugs can have a little problem on platelets with this dengue season coming. Do not use any other antibiotics, use only paracetamol. If the fever is 103, 4, and if you give paracetamol, the temperature will come down by 2.5 degrees. So accept 101 temperature, don't try to bring it to 98. Then it will reduce your threshold of stress. 101, you should feel happy. If you want to bring it down and it is not coming down with paracetamol, please do sponging. And sponging is important. Once you make a decision, the fever must be 103 and above, the paracetamol must have failed, and then when you do sponging, strip the child totally, put on the fan at full speed, take tap water, not cold water,
Yeah.
apply over the entire body. With the hot body and the fan, this water will evaporate. The latent heat of evaporation is what cools the baby, the skin.
And the same thing is true with the adults also.
Yeah.
And we have finished 1 hour of our program. So we have learned a lot today. We did talk about all aspects of neonatal care, natal care and postnatal care. And the message of the day today is only one, and that's what IMA recommends, that every pregnant lady should identify a pediatrician the time you have a baby shower function or a good cry function, that is after 20 weeks. And they should consult when you have antenatal visits. You should also have an antenatal pediatrician visit so that they prepare you for the baby well in advance. That's all for today. Let's thank Dr. Rajeev to be here with us and Dr. Ramesh Datta to be here with us. We'll be back next week. Next week I may not be in Delhi, and I'll be visiting the SIMA conference. Dr. Monga will take over and we'll come back with one more subject. Till that, say goodbye. Thank you.